Hi, Kim Buck.
Well, hello. It's good to be here today.
It's great to see you again. So it's been a few weeks since we've done this together, so I'm excited to see you.
Yeah, we had a
So,
break there for Thanksgiving. So I'm glad to be back and welcome to all of you who are joining us live today and those of you who may be watching this recorded. We realize not everybody can make it at the time, but anytime you can, we'd love to have you join us. Like Tammy said, please type in your questions. There's not a wrong question. There's no incorrect question. So if you have things going on and you would like a little bit of feedback or more education about something, that's what I and Tammy and I are here to do today. So glad to be here. So again, I'm Kim Buck. I'm from Arizona, so I'm in a little warmer weather than a lot of the world, but I work here in Mesa, Arizona. I'm the clinical director at a pretty big agency, but I have kind of a private practice inside that as well. But we treat a lot of people who struggle with sexual compulsivity or problematic sexual behavior, sexual addiction, and betrayed partners or family members there. So I've been working with this for about 15 years professionally, and I'm really excited about Prodependence. That's how I got here. I met Dr. Rob and read his book and heard him give some presentations about Prodependence, and it resonated immediately for me, as hopefully it has for many of you who are familiar. I assume you are because you're here. And I will answer any questions that you might, the best I can, about Prodependence, and most of our answers and responses will come from a prodependent perspective. And I'll kind of point that out as we go. So, and if there's a lull in questions, I might just bring up some topic discussion or maybe give you some practical tools or things that might be helpful to use in your healing journey if you're a partner or family member. So I don't know if we have any questions yet, but if not.
we don't, but I wanted to share something that Dr. Rob was in Singapore over Thanksgiving, and he had done, when he was in Minnesota, he actually had been in Minnesota presenting to some professionals, but there was a group of partners who right away when the book came out, they had contacted me. So it was like a year ago fall, and they're like, love this, and it was really transformative. They, in their group, have created, very codependent focused in the support group. Unfortunately, there aren't mental health professionals that have really engaged with all of that in their area. So they're really doing it more as self-support. Would love to have more professionals. But one of the things that happened, so Dr. Rob went and just chatted with this group. There was about 35 people, and included both the partners and some of the addicts as well. But he had a time of sharing. Then he went to Singapore and had a similar experience just with the partners. But one of the things that they commented on was how they're obviously a long ways away and timing doesn't work out, but they've been listening to the podcast, but also the webinars, and they, as a group. So they're using this material, they're listening to it, they're engaging with it, and then they're having a discussion about it. And I thought, wow, that's really a brilliant way to kind of help, each other, along that way. So that was just different, and I wanted to share that. So we do have a question. Can you please explain how you start with Prodependence treatment? Do you have to read the book first? How do you start with this? Great question.
Yes, it is. So it's a kind of an interesting question in the way that Prodependence isn't particularly a treatment per se, but it is a way that we do a lot of the treatment that we've done before, but it's the way that we look at somebody who is in a relationship with somebody who's struggling with addiction. So the way we formulate treatment is we look at the partner as somebody who's in a situation of crisis, not of their own making, but is trying to figure out how to be healthy within that crisis. So reading the book is a great place to start as far as getting a feel for what Prodependence means, which is just that. It's just not blaming a partner any longer, like telling a partner, a family member, there must be something wrong with you because you're in a relationship with somebody who has an addiction. And back I mean, in our history, we've called that codependence. It was kind of a way to try to explain what it was like to be in a relationship with somebody with an addiction. And the assumption there was that, wow, you must have an illness too. Codependence must be your illness. And Dr. Rob, as he's articulated with Prodependence, is saying, absolutely not. We are in relationships with people, and sometimes people struggle. And that just means our life becomes a crisis too, because of the decisions of our loved ones. We may need to learn how to love in a better way, a healthier way. We may need to learn how to set boundaries and take care of ourselves better and all of that, but that doesn't mean that there's something wrong, inherently wrong, or there's some sort of diagnosis of me because I'm a partner of an addict. So beginning treatment would be kind of getting your feet on the ground of what does it mean to be a partner, what's going on in my life, and then finding a qualified therapist and support system that can help you from a prodependent perspective, which is, please don't blame me for the choices of somebody else. I think hopefully that's a little bit helpful. And obviously we're working on getting more prodependent information out to the public and to clinicians and therapists and people who help individuals in these situations, so that they will potentially stop using that codependent kind of hurtful paradigm.
Yeah, so sorry. So when people reach out to us, I always say it's a different lens. We would never, as people were called codependent, we would never say, oh, you're prodependent. It's really just looking at a lens, not changing one label for another. And it really is about attachment. You love this person. You understand that they're broken, but you love this person. And, as Dr. Rob says, love is to be celebrated. But like, Kim said, could there be things to do, healthy boundaries, some things that would be helpful for you to put in place for your safety? Great, let's explore all of that, but not pathologize. I get so many, calls and emails from people that I've been villainized, I've been victimized, I've been traumatized by therapists, friends, family, spiritual advisors, whomever, because, they're going like, I'm going looking for help about my loved one that I'm concerned about, and I'm getting told that I'm the problem. John Taylor, in one of his webinars, mentioned that he says to clients, he says, I could replace you with anyone on the couch, and he would still do the same thing. So it isn't you. There's nothing you could do or not do that's going to make that different. With addiction, and Kim has shared this before, and I've used this. In fact, I just used it in an email a little bit ago. That you talked about it's in the same part of the brain as breathing, and so it's the defense of acting out is crazy, but it's also defended like, well, I need to breathe, so I need to do this, and until they get help so that they move it into the thinking part of the brain, they do stuff which by any measure, anybody else looking at it would go, that's insane. And it is, and the other thing, when you mentioned prodependence treatment, I always, I try not to use those words, but, my suggestion is always, I did it again, that partners deserve support. You don't need treatment, in my opinion. It's, you deserve support. This has been traumatic. This is chaotic. You're dealing with, a bad situation right now, not of your own making. For people that are married, I talk about when you said your marriage vows, you didn't know this was going to happen, and there's no manual on, well, when addiction hits, this is what you're going to do. There isn't. So it's really about getting support for you, treatment for the addict, hopefully. But yeah, I think you'll find Prodependence a valuable way to look at this. And there's Prodependence. There's this, but there's also Prodependence aligned partner support groups on the site. I mentioned before we started that, I'm subbing in for the next 3 weeks. Angela's going to be at a training and off. So for the next 3 weeks at the Sunday night one, but there's multiple opportunities every week, for a prodependent aligned support. For those of you, and there's an old lady posse, they named it, but for those who are of a certain age, empty nesters in a longer term relationship, or have ended a longer term relationship, but are looking for support and accountability, that could be a fit too. So, but I think Prodependence really changes the game, where you get support and not, what happened to you, or why, what are you, one of the things I really hate is, you're addicted to the addict. You love the addict. You love this broken person. So,
well, it might look that way. I think that's why sometimes people want to come up with a reason, like, why is he or she acting that way? Why are they following their spouse around town and trying to figure out where they are, or hiding the alcohol, or going through their phone records or their history on their computer? And, if anyone was betrayed, they would be seeking safety. And most of those behaviors, even though they might look, and sometimes they are crazy, sometimes they are not healthy. They might not be healthy for the partner or the addict, but the desire to create safety when your world's been turned upside down is a pretty typical feeling that most partners feel. So what you really need is somebody to help you navigate that crisis. It's like walking through a minefield a little bit, somebody who can say, hey, try this, or, well, you don't need to worry about that, or I understand why you're doing that, or, here, let's take care of you and some of your needs, and let's figure out how to communicate that best with the addict. And because, yeah, I think Tammy's hit it on the head. There's just no manual for that. Like, when, none of us, most people don't go into relationships having all the answers for future problems. Like, we deal with them, in real time. So, but that crisis that's created by addiction is really destabilizing, most often for the partner. You could be feeling like, I'm functioning pretty normally one day, and disclosure happens about this, and the next day I can't even remember what I had for breakfast, or and that's some of the trauma and how that affects the body and the mind when that crisis occurs. So I think it's okay to even ask your support system, get on one of these webinars with me and learn about it, or read the Prodependence book. Ask your therapist to read it. I really want to be treated this way. It is not a stretch for most therapists or people in the professional world. Most people, where Dr. Rob and I and others have taught about Prodependence, they are very open to it, and it clicks very quickly for them, because most therapists honestly don't love codependence. That's just kind of all we've had. So now we have something else, and something better, and something that actually works and actually helps the people in that situation.
So a follow-up question, how does this relate to a spouse with a personality disorder? So not especially an addict.
An addict with a personality disorder?
No, I don't think it's specifically an addict. So Dr. Rob wrote the book because of what he experienced. His mother was mentally ill. She wasn't an addict. She was mentally ill. And so as a caregiver, he was told that he was being codependent. And when she showed up in the middle of the night, flown across country in the winter underdressed, that he should just shut the door on her, and, she should learn to take those meds. And, so we really talk about Prodependence is not just for, sex addicts or addicts. It's really about the loved ones who are dealing with, caregiving, to someone who is struggling. I even think it's, for people who have, physical challenge, that they're constantly dealing with that. Although I think it's easier for people to get behind loved ones who are, helping someone who is, physically challenged. They get more of the, oh, you're doing a good thing, and it's challenging. So this whole framework was really written, in that context.
So it's very applicable to if the question has to do with maybe the addict having a personality disorder, or the loved one having a personality disorder that's struggling, that would be a chronic mental illness. Addiction is a chronic mental illness. So the need for the caretaker, partner, loved one that is in relationship with this person really is the same. You are almost always managing some sort of crisis. You are learning how to communicate in healthy ways. You're learning how to meet your needs and wants, particularly when they are unwilling or unable to do that. You're learning how to be gentle with yourself and give yourself compassion and care and nurture when you need it. You're learning how to stay balanced in big areas of your life, because if you're dealing with a chronically mentally ill person, they are going to shake the foundation frequently. So I've got to figure out where to build my foundation, and so I can stay steady and strong if I'm going to stay in that relationship, or I feel like I need to, or I want to. So it really doesn't vary. Prodependence really covers, like Tammy said, all of those things. It could even, chronic mental illness to even, you're right. I think the difference between mental illness and physical illness is we applaud people who love and caretake somebody with a physical disability or an illness like a cancer or something like that. But for some reason, we want to be really, historically, we want to be really hard on somebody who's in a relationship with an addict, which is also dealing with a chronic illness. But it has all these stereotypes, like there must be something wrong with you. You just need to like detach and let them be who they are and go be you. But the problem is we're wired for attachment. Like we are wired that way. And we are most healthy in secure pair bonds and attachments. So we may or may not be able to stay with somebody who's chronically mentally ill if it's a spouse or a partner. But I need to probably figure out how to navigate that relationship for myself and take care of myself in it before I make some of those decisions. And that's some of the confusion. It's either, gosh, I stay here and live in craziness and I feel crazy too, or I leave. Well, Prodependence has you sort of look in the middle. What's the middle here? Like, can I be in the relationship and be healthy? And is there a possibility of healthy attachment here? Because most people don't get married to get divorced, or they don't, they're not in a long-term relationship because they don't want to be. Most people, they love that person. They have a lot of connection with that person, even outside of the problems that addiction brings. So it is very applicable there. I don't think it takes on, there's challenges to personality disorders that to me, that's an extra layer or two or three. If I have addiction and I'm a narcissistic personality disorder or a borderline personality disorder, there's going to be different types of treatment and different layers that I'm going to have to work with.
And this person is not an addict, not just, but no addiction, just the personality disorder. So
I think it would be very similar. And a personality disorder is not something that goes away per se. That's something that's pervasive, that will be there throughout their life if it's a true diagnosed personality disorder, but it can be managed. And with the right therapy, it requires very professional therapeutic intervention for the best outcome for the couple and the individual. We lost you.
Yeah. My phone is like, it never seems to stop when I'm on a webinar. Ding, 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 all and I turn them off and it doesn't matter. So anyway, somebody commented, I think the new name for our stress should be post-deception stress disorder. I wanted to share something that I heard, and it's really fascinating, and I hope they do. I'm trying to help this person do more of a study on it, but she did so it's more anecdotal. It's not research, but it's so aligned with, some of the other trauma information. But many of the partners had gone and sought help for physical ailments, I'll say, before there was ever disclosure or discovery. So it was like their body knew something was going on. Even like 40% of them had gone before they ever knew, but like 80% of them, had done it. So yes, absolutely the body is having a stress reaction. I know lots of partners who have autoimmune issues and many other chronic things. And I think it really relates back to the stress that they are constantly under.
And that can be, just add another layer of a struggle, in that crisis. Not only am I dealing with my emotional pain and my psychological pain and and the hurt and all the stuff that goes on there. But my body's kind of paying a price too, because stress, our bodies will pay a price for high stress. And so that's a difficulty. One, you can utilize that. I've talked about this in previous webinars, what's going on with my body and where is it in my body. And sometimes that's an indicator that, I need to employ some extra tools or some extra interventions to help myself and help my body through the crisis.
So interestingly, I am a jaw clencher at night when I get stressed. I'll wake up going, oh my goodness. And the other morning I woke up going, oh my goodness. And so, had to wear my bite splint to break it up, and that, takes it down a little bit. But yes, it's interesting, where it shows up, my shoulders, or if I'm clenching my gut, so it just depends. Okay. So next question, how would Prodependence explain this? My partner, who has been in recovery for about 5 years, just disclosed something that was quite different to how it was disclosed 5 years ago. What I have learned is devastating. However, like a bowling pin, I have jumped back up and appear to be coping with it when it should be a deal breaker. I'm really feeling like there is something wrong with me. No, there's nothing wrong with you. Okay.
Yes. First of all, I'm sorry you got more information that far in. That's really painful. That's like, why can't you just tell me the truth, all the truth, when we're in truth-telling mode? So I just want to validate that, kind of feeling like I got ran over by a truck 5 years ago and I just got back over. It kind of re-traumatizes and kind of sets off some of those probably fears that you've worked through some or tried to over the years. I don't think there's a thing wrong with you that I think you said bounce back like a bowling pin. Probably a lot of that has to do with whatever you've done for yourself over the last few years. You want to be careful. Sometimes the instinct is to stand up and just keep walking, just like we were talking about. Pay close attention to your body signals, because even if you have great tools and things to lean on, your body will have an impact. So you'll want to be extra aware and do extra self-care, you're here, you're talking about it. I don't know what your support looks daily, but put more support, more tools, just as much as you can, because there'll probably be a few days ahead that you might not feel as strong. And that doesn't mean there's anything wrong with you either. I feel like you kind of have to get through any crisis like this before we can make a grounded decision. And a lot of partners are hard on themselves. Like I told myself if this happened, I would get out. And I just think the small print in all of those I reserve the right to decide how I feel when it happens. Because you can set up all those hardcore boundaries, but there's a lot that's probably happened and has transpired over the last 5 years. So that decision might not be as easy as you thought it would be 5 years ago, or however long you set that up. So, and leaving is always an option, or ending the relationship is always an option. One of my favorite things to say is you're never stuck. You're not. But, figuring out how to reground and recalibrate and process the current information before I make a decision, one way or another, will be really smart. Really smart. And protect yourself however you need to throughout that. But it's okay. It's okay to hit the brake. It's okay to not be like, well, that's what I said and I'm out. Relationships just aren't like that. They're a lot more complicated than that. How much life have we built together? What investments have we made into this relationship? That's not easy to throw away in a day, no matter what information a person might get. So I would say be very gentle, show yourself a lot of self-compassion, ramp up your tools and your support, and give yourself whatever time you need to process that new information.
And I was thinking, I don't know what your disclosure was like, but disclosures that just happen without therapeutic preparation tend to have things left out. So, and I don't know, I'm not, you may have done it, but and addict, and I'm not making excuses, but addicts really do forget. It's so compartmentalized. that until somebody goes, well, what about that little silo over here? Things can be, but I also thought, if your partner knew this was a deal breaker, it may have been, I'm just going to hold on to the secret, because like, I don't want to, and I don't know what the circumstances of why it came up now, but 100%, you've got 5 more years of like, working through things, connecting more dots together so that, you've got more of a history. So be really kind to yourself. It isn't you. And I love, Kim, when you're talking about the fine print, that I reserve the right. I love that. And I'm going to remember that one. Because I think that is really true. It could be a hard and fast boundary now, but as things have, progressed and, we've made progress, we've built more of a life, and now, okay, that wasn't fair. That wasn't right. Whatever I need to do to make myself safe. But and honestly, it may be, for me, I probably would be going, I want to go see a therapist and make sure that we've got all of the disclosure, that there isn't going to be another one happening in 5 more years, doing what's going to feel right for you, but no blame, no shame. This isn't you. So
it's so interesting how it's so easy to want to just go and blame ourselves or yourself. Like, all of a sudden there must really be something wrong with me, that we have a culture that still wants to, even we want to do it to ourselves. I want to blame myself, obviously, for whatever reason. No matter what the reason, there's no excuse for lies. And, in that regard, as far as there's no justification for lying and deceiving somebody you love for whatever reason, but there's but that's still an individual choice of, in this case, the addict. And you have every right to decide how long you need to figure. And I like what Tammy said. Usually if it's not an official disclosure and done in an official professional way, there's likely that there's details, even if not, they were as honest as they could be about the big things. There's a lot of detail there that there's just a lot to work through. So there absolutely is not a wrong way to respond to that. I think there's a shocked way to respond to that, where you're going to have to just sit with that and talk through it and get the help you need to. It's like you got another bomb dropped and you're like, well, I kind of figured out how to clean up this mess. Now I've got kind of a new one. But the cool part is I know how to do this. And I may or may not be able to stay in the relationship, but I know I've walked this path and I know how to do this, and just kind of be gently walk yourself back through those steps.
So Dr. David Fawcett did a webinar a while ago on resiliency. And I always thought people were resilient or they weren't. And he talked about, no, it's a skill that you build. And I thought, you must have built more resiliency over these past 5 years, along the way as well. And then the other thing I had a thought about was when addicts are doing a 4-step, often they go back and redo their 4-step because more stuff comes up. So again, not justifying, not making excuses, but just kind of going like, I don't know the details, but I mean, there could be reasons. It could be good reasons. It could be poor reasons. But I think I'd give yourself a hug for the resiliency you've built over the past 5 years too. I think that's, it speaks to something. And then Kim, the next question is kind of talking about what you were just talking about too. I put boundaries and ended the relationship, but I am worried and feel guilty. But he was very abusing and traumatizing, and putting myself first feels egocentric or egotistic, whichever. But I was like, just like you were talking about that, if we do something that protects ourselves, we feel bad about it. Can you talk more about that?
Right. There's a sense that I'm selfish for taking care of my needs. And that's not uncommon. I guess I want to say that's not, unfortunately, that's not an uncommon feeling. I think, if you've decided to end the relationship, there's probably grief and loss, and I'm trying to detach, and that probably does feel a little bit selfish. But there's certain steps that will have to be taken just to let go and heal myself and kind of let my feelings of responsibility for, my partner, let him take those or her take those away, and take them and own them and take care of them. I think one of the concepts I was going to bring in today that I've been working with a lot lately is the concept of self-compassion by Kristin Neff. I love that concept. And she talks about, self-compassion versus self-judgment. And we want to, it's just so instinctual for us to feel guilty to take care of ourselves, or to say no, or I'm sorry, but I can't. I love you, but, those kind of things unfortunately don't come naturally to us sometimes. And especially if you've been trying and working and kind of grinding through difficulty in the relationship, and you finally feel like I reached my limit and I can't do that any longer. I would get a lot of people around you to check that in with. I doubt people who love you would ever blame you or be judgmental. They could, but find people who aren't. If they are, that's about them, not about you. And so Kristin Neff's work talks a lot about how to support myself through my suffering and through my pain and my grief and my loss, not just blow sunshine up my nose, but really learn how to sit with myself and work through those feelings of loss. And sometimes feelings of loss and grief turn into self-judgment and self-blame, because I'd rather it be my fault than no one's fault, I guess. And truthfully, it sounds like, the injury to the relationship became greater than what you could withstand, and that's okay. It's okay.
So someone tagged on, self-care is not selfish. Self-care is kindness and love.
Thank you.
Yeah, I think that's, yeah. And honestly, like, how can we love someone else if we haven't figured out how to love ourselves? And I think that's really, a core thing is, if it's always going out, we still need to, I needed to learn. That was a big thing in recovery. I had to learn to, at first, like myself, but there wasn't a lot of that.
Well, it really isn't natural sometimes, and it does feel selfish. Setting a boundary sometimes feels selfish, and this is kind of the ultimate boundary in the relationship. And saying no and I can't do it anymore it's right, it is self-care, and it is you taking ownership of your limitations. And I love the analogy of a plimsoll line. A plimsoll line is it's the level that each boat on the water can hold, the load limit. And every vessel is different, meaning their plimsoll line is different. Some boats can carry an enormous load, and some can barely carry, very little. But that doesn't mean one boat's better than another. Just like not one person or relationship is better than another. You reach that load limit where when you start taking on water, then I no longer am me. I can't float. I can't be useful anymore. And I think it's hard to acknowledge that I've reached that sometimes for some people, but being not wanting to sink to the bottom of the ocean and become a relic is, I don't think, a selfish thing.
So the next question, can you address the connection between addictive behaviors and having the personality trait of being an empath? My husband, not in recovery, has the wonderful gifts of an empath, has a sensitivity, but the curse of being a big time absorbing the pain of others when negative emotions come up. Physically, bodily, practically curls up. I've observed these traits in him for decades. Realizing he is an empath gives me a greater understanding of him and possibly making adjustments about how I respond, or if I choose to respond. Your thoughts about empaths and addiction?
I think empaths could potentially be more vulnerable to addictive behavior if they don't know how to properly process heavy emotion. And that's a problem for any addict, dealing with negative emotions, heavy emotions, sadness, anger, loneliness, tiredness, boredom, stress. Those usually, addiction starts when I don't know how to deal with emotion that overwhelms me. So if you look at somebody who's very empathic or who is very in touch with other people's emotion to the point that they sort of can take on that that darkness a little bit and that stress and that heaviness. If I don't have good coping skills and I don't know what to do with those emotions, I don't have good boundaries, meaning where I end, where I end and you end and I begin. I don't have that delineation between myself and another person, which addicts don't have either, by the way. That's going to be problematic. I'm going to want to self-soothe in maladaptive ways, in unhealthy ways. So addicts start, using things or behaviors to try and calm their overwhelming emotions. So an empath and an addict that's an empath would not be a surprise at all to me. I think that happens a lot. I've treated a lot of individuals, men and women with addiction, that are heavy feelers. They love a lot and they care about what other people, but they don't know how to take care of themselves. That's the missing piece. So it's one thing to love and care for somebody else and be emotionally sensitive to them. But if I don't know what to do with all that emotion, and if I learned at an early age, most often, how to soothe myself in compulsive ways, then I'm just constantly vulnerable to that addictive behavior. So basic addiction treatment absolutely will be needed. How to create balance, how to have boundaries, how to deal with, what to do with uncomfortable emotion, how to have support in that, all of that kind of stuff that addicts have to learn would apply to somebody who is empathic, very empathic as well. And that can be a great gift to a relationship. As that person heals, as that addict heals, he or she will learn how to, maybe it won't be so hard for them to connect and have empathy for you. But they can't do that very well and very healthily until they learn what to do with it through very specific treatment for that. And I think too, I lost my train of thought. It'll come back.
It will.
Show my age, dang it.
I hear you. I totally relate. So, I was thinking that too. It's like all addicts are really bad at handling emotions, but you were listening to the bad ones. I was like, oh, we don't even handle good ones. If it's too intense, blah. So, addiction, the acting out, is escape, numbing out, whatever. But sad that it sounds like he won't choose to get help so that he doesn't have to take on all that heavy lifting and, end up in a fetal position, and it's a distancing thing too, because I bet you end up not engaging with him. Sorry, Bosley. I'm sure we're getting something. Anyway, so but I thought, I bet you have to keep a barrier because, it's just too much hassle. I can't tell him about this because, he's going to end up in a fetal position. So I just won't even bother. But that's a disconnector. And it's not, then that doesn't create, someone you can go to and connect with. So hopefully you're getting support so that you've got the support you need, to share things that, might be deemed negative and problematic for him. But gosh, I really wish he would, choose to get, help, because he doesn't, I was the queen of not dealing with, emotions. And when I first got into recovery, I was feeling them, and someone said, well, what are you feeling? I was like, I don't know. I'm just feeling it. I hate it, and I was that numbed out to everything. But I learned tools, and, like the resiliency I just mentioned, I learned tools so that, if I'm feeling something and it's uncomfortable, well, I have choices, I don't, curl up underneath my desk. I'm able to, to process that in a healthy way, and I'm able to connect with people. I'm able to hear when they're painful or joy or whatever, not take it on personally, to understand, like you were saying, Kim, this is where I am, this is where they are. And if I'm going to be here and be helpful for them, I need to be upright. So.
And I do see people build resiliency in recovery. I see addicts do that big time. Most, recovery requires some amount of group work where you will sit in the pain of others, whether it's, a support group or a psychotherapeutic group. You're going to sit and hear other people's stories and their pain and their experiences. And part of the reason for that is it builds resilience. I can learn, I can be here and present and helpful and empathic and still button back up, go home and live my life and not somebody else's. That's a part of that learning process as well. So I really hope, and maybe that will be the encouragement. I want to be close to you, but if I'm constantly in fear that you have no tools to deal with my emotions, then I'm not going to want to share. And that's a problem for us. That's a barrier for us. And, that I don't like how that feels. It's an idea.
So the next one, hello, I'd like to know where I can find a good therapist for me and my husband. I sent a message to the website. I did answer that. I actually remember, I see your name and I actually did answer. He's addicted to pornography since before I met him, and I just found out recently, and it's been extremely hard for me, and it is, I know that. I know that this is a basic question, but I'm new to this and I'm kind of lost. I'm so glad you're here, honestly. So glad you are here. We did couples therapy before, but I think the therapist did more harm than good. I hear this all the time. It's like we were talking about at the beginning. So I'd like you guys explain how to find good therapy. So Kim, why don't you, so depending on where you live, Kim is in the Phoenix area, and she's mentioned at the beginning, she's got a huge practice with lots of therapists, and this is what they do.
Yeah. In Arizona, there's several different organizations that train therapists to treat, if it's sex addiction, pornography addiction, and betrayal trauma. The certified sex addiction therapist is what is probably most recognized. They're called CSATs. I would look for a CSAT therapist who has training in both addiction and betrayal trauma. Couples therapy is not usually warranted in the early stages because there's so much hurt and pain between the two. Most times, both the partner and the addict will need their individual therapist to help the partner ground, deal with her pain, her loss, the trauma, the crisis, and for the addict to get on the path of healing for, in this case, your husband, so he can learn the tools to deal with those, those overwhelming emotions, and to get accountability, to get support, to start to rewire his brain. It is this type of addiction is an injury to the reward center of the brain, because I repeat behavior and I create this neural pathway in my brain that takes me back to the same unhealthy patterns over and over and over. So we have to learn new patterns, new ways of coping, new ways of dealing, how to get honest, how to get open and transparent. So CSAT therapist, there's other certifications, but there needs to be some very specific training. You're a general therapist without any sex addiction training, extra sex addiction or betrayal trauma training, I would not go to. It's a very specific, and there's things that I don't treat because I've had no extra training. I could tell you, I could list many of those. I don't see people with those particular issues because it's out of my scope of practice. And a lot of therapists may see people who have addiction or see them come through their office, but unless they've had extra training, they shouldn't be treating them, in my opinion. That's an opinion. I think that's a general opinion.
No, any therapist, their licenses don't treat outside the scope of your, abilities. Unfortunately, too many therapists believe that they have the skill. Oh, I've been treating, alcoholism for, years. I can do this, and not understanding how complex it is. And so I hear this all the time. The other thing is, and I use this analogy, when people call in, I shared it again the other day, when I had sinus surgery, I went to the sinus specialist. I didn't go to my GP. I didn't go to the general practitioner who, checks my blood pressure and all that kind of stuff every year. I love him. He's great, but he does my general stuff. When I have something that I need a specialty for, this is going to the sinus specialist. My husband had knee surgery. He went to the knee specialist. He didn't just go to somebody, oh, I can fix that. So it's like this. Why would we trust, somebody? Now, I also get when they say, I can help with this. We hear that all the time with treatment centers too. Oh, we can help. Well, we only say, so Seeking Integrity program helps men with sex addiction, intimacy disorders, or co-occurring sex addiction and chemical dependency. That's it. We don't treat everything. We don't try to. We don't pretend to. That's all we do. And we turn people away if they are not a fit. We only want to help people that we can help. We don't want to waste people's time and money and the pain of having failure because it's not helpful. So I just I had sent you an email. I just resent it, and I typed in the chat where I sent it to, because that was the message that I had gotten. So hopefully you do receive that. But there is qualified help. Consider to the couples workshop. We have a couples workshop December 13th through 15th in the Los Angeles office. Another one January 17th through 19th. There's only one couple spot left for December, and then only 2 spots left for January. All 4 are open for February. But yeah, if you want any information on that. But otherwise, at seekingintegrity.com, you'll see all the treatment, the workshops. There's men's 3-day, there's couples workshops. So really great, helpful, healing things. And if you're looking for a specific location of a therapist, I know lots of them. I know some that I would recommend to family and friends, and some that I wouldn't. So you'll get my opinion if you ask, but feel free to just go find your own. You don't need to ask. So
I would also say, don't ever be afraid to ask a therapist. I am always just amazed when someone comes in and says, what are your qualifications, and where did you get certified, and how many couples have you worked with this issue? And I would ask those. I'm always happy to answer that. I'm like, good for you for looking out for yourself, not just believing me, so asking for that and looking me up and finding out if I'm qualified to do what I do. That's okay to do that. And I hope that people will. Like Tammy, if I need a specialist, I'm going to go to a specialist. And I'm the clinical director. There's 21 therapists, or 22, 3 maybe in my office. But I always tell them I'd rather you be really good at 2 or 3 things than mediocre at 20. So, stay in your lane and refer people to the people who do the things you don't do. And that's what I do all the time.
And it's okay to go to a therapist. Like people's needs change too. If you go, gosh, for this is what I'm going to, and it's a specialist for this particular thing. And now we've grown, or I've grown, and now I need something different. That's okay. You can find somebody who meets that. The other thing is, you don't have to like your therapist, but you should respect that they can help you. So in fact, my therapists have been, I actually have liked them because they were helping me. But it was one of those things where, the things that were painful and challenging and all of that kind of stuff. I wasn't going to get, everything is, you're doing so good. I needed the help. I wanted to get through those things. So have clear goals in mind. I think the more that you go, I need support in this trauma, or like I have a pattern of it, whatever, I think the more you're clear on what you need, if it's trauma right now, I hear things are really challenging. I just found out, that go for that. You need support, in the trauma. So next,
I want to
go
say
ahead.
that one really fast too. Just hang in there. I know it's so painful in the very beginning and confusing, and there's a lot of people telling you probably a lot of things, and sometimes try and trust your gut, do your homework. I'm so glad you found this webinar, and the support groups here are wonderful. They're all Prodependence based. Nobody's going to blame you or tell you it's your fault or give you anecdotal advice that doesn't help. We all dedicate and donate time here to help try and maybe steer people to the correct types of help and give correct information. So there is a lot of help out there. You're not alone, and I'm sure a lot of the partners here in this group can attest to that. It feels isolating and scary at first, but there's some wonderful community of healing and recovery for this problem available almost everywhere.
So the next question, I found out about my husband's infidelity and sex addiction about 12 weeks ago. I am really sorry. I know how painful that is. My husband is going to an individual therapy, SAA meetings, reading books, etc. He tries to do something treatment-based every day. That's great. My husband appears to be doing and saying all the right things. However, I feel like he is just going through the motions, so I will not leave him. I don't think he really understands how unhealthy he really is. And since I have not left him, I don't think he really understands how much damage he has caused. Is this feeling common for a betrayed partner?
Absolutely, it is. And especially in those early stages, he probably doesn't have a clue yet how much damage he's caused to both himself, to you, and to the relationship. He's probably in survival mode, much like you are, trying to just plug in everything that everybody's telling him to do. The good news is he's listening and he's doing. And sometimes that will feel, and because your trust in him's pretty obliterated by the disclosure, there's not going to be a lot that he will do right now that will heal all that. You'll have moments of hope where you'll feel like, oh, okay, well, good, he's doing that, and maybe, or you'll meet somebody else that's gotten better and think, okay, well, maybe we can do that too. But right now it feels really uncertain and scary. So just like him, but for your reasons, I would get as much support around you, because he won't probably be able to hear or hold the type of space that you need him to right now, because he's just really new into his own work. So find other women who can relate to your experience and can hold some of that space for your pain and your uncertainty and your doubt, and your grief and your loss. And that's a long answer to your short question. Is it typical? And it is typical, very typical. And him doing what he says he's going to do over a long period of time will rebuild trust. Him staying consistent, and eventually, as sobriety doesn't just happen and I'm not acting out sexually, or I'm not drinking, or it happens in your emotions. It happens in your mental states. Sobriety you can take away the behavior, but learning how to be sober isn't just being free of the behavior. Learning how to be sober is learning how to make good choices, learning how to be honest, learning how to be accountable, learning how to act in my integrity, learning how to be non-judgmental, be reliable. I mean, learning how to build a spiritual life for myself. I mean, there's so much that goes into sobriety. Just removing the acting out behavior is like step one, and admitting that I can't do it myself. I'm not gonna be able to fix it all by myself, that it's beyond my ability. So he's kind of in that space right now, but over time, he will integrate all that other type of sobriety if he keeps at it and keeps working.
And I so agree. And, he's going, I've got 3 months, yay. And you're going like, whoa, whatever. But 100%, it's a lifelong pattern of, Dr. Rob and I talk about, all addiction being an attachment disorder, an intimacy disorder, and it isn't, and it's just a symptom. So the acting out is just a symptom. So until and unless we get to, to that underlying stuff, but we can't even address that early on. It's just like, okay, I'm going to read, I'm going to my meeting, I'm calling my sponsor. Dr. Rob talks about this on the webinar on Monday night quite a bit. Behavioral problems need behavioral changes, and I give him, he's doing good things, and you don't have to or want to trust him for a long time. It's usually at least a year and a half, with him doing the things he needs to do. If he hasn't read Out of the Doghouse yet, highly recommend that, because that's one of the things, in Sex Addiction 101 in the workbook are really good too. But, that helps. Like, oh, I said I was going to take out the trash. I'm going to take out the trash. I said I was going to take out the trash. I didn't take out the trash. I lied about taking out the trash. I need to come and tell you I didn't take out the trash, and whatever. But it's all a learning process, and and it's a lifelong because for me, the stuff that I was hiding in addiction was, a lifelong thing. So when I got into recovery, I'm trying to address problems that I'd had, forever, and I did. And just like Kim was talking about, like all of those skills that I've learned in recovery are just part of how I live now. I don't think, well, this is what I have to do. I've learned it. it took time, and it wasn't overnight. So get support for you. I hope you're joining the online on this site. There's on sexandrelationshiphealing.com. There's webinars for betrayed partners. Please join those if you're listening to the podcast, both of you. There's some great ones that are really helpful. Kim's done a Prodependence webinar. I've done a couple questions and answers, but it's one of those things where you both will get support that will help you go, yep, this is just how it is, we're doing okay, or this is a little bit of a thing that we need to address. So but I'm so glad you're here asking questions.
Absolutely. Be patient with yourself too. Don't judge yourself for not, he'll want you to trust him quickly. They'll be like, look what I'm doing. Look what I'm doing. And what else can I do? And there's not much. If he's doing everything he can do, then he just needs to keep doing that. And he needs to be patient with your process of rebuilding that trust. Because remember, good behavior over time builds trust and reliability. So I love what Tammy said. Yeah, there's just so many things, and he's rewiring the brain. And it takes time. That we have some numbers out there. It could take this long or this many years, or but I found, and some of those are pretty on point. But I think we just have to kind of buckle up a little bit and take care of ourselves, speak our truth, get our needs met. And if he can't hold space, find people who are healthy who can, as he wanders, and cleans up this big mess. And it is kind of a mess. So,
and I think you'll see, and you'll connect dots, and you'll go, okay, it's been like it's only been 90 days. So, but like in the next month, you go, have things gotten a little better? Do I see progress in his behavior? Do I see, that, and if you're even seeing little baby steps, you can start connecting the dots and have more hope, not 100% trust. You, like Kim was saying, you need to be safe. You need to create that safe space, know what your boundaries are. And like I said, he gets applause at 12-step meetings where he gets his chip, and you can just go, sure, 90 days, great, but look what you did over time. That's all fine. That's all normal, but like I deal with lots of phone calls and emails, and I know Kim deals with lots of clients too. I see a lot of hope for each and both of you. So I encourage you, to continue to do things. I mentioned a bit ago about the 3-day workshop for men. There's a 3-day workshop for couples. Those can be really healing experiences too, and helpful. So, if we can help. We have time for one quick question. I could not find help for many years, not even for myself here in Europe, till even now. So finding help or an intervention for the disoriented spouse partner, I think, feels like so much work, and I'm so tired, and it comes on my shoulders again while he doesn't show any interest.
Oh yeah, I'm so sorry to hear that. And yeah, I don't know what support looks like in Europe. I wish I could give you more, I wish I could be more helpful there. I know we're going to Europe next year, talking about Prodependence.
Yes.
With the ICAD, I believe.
Mm-hmm. Yes. I think at the end of May, but don't hold me to that.
I think so, somewhere in there. But it is tiring. It can be really exhausting. And that's kind of part of the trauma. That's part of the, for the partner, because you've been putting in the work all along and didn't know you had a partner who kind of, if you're proverbially rowing a boat, you didn't realize he stopped rowing every now and then. He just takes a nap, and you feel like you're the one, trying to propel the relationship forward, and that can be very, very tiring. I want to validate that. But I want to piggyback what Tammy said a minute ago. Sometimes I get this question, why would you want to work with this, or, see partners or people in so much pain every day? And this work picked me too. But I want to say I've done it for a really long time. And if I didn't see hope and people heal, and it is not easy, I'm not saying it's an easy road. I'm not saying that. I would have quit long ago. I And so I don't get to share all those victories because they're personal and they're private to, obviously, to the people who experience them, but I see them every day. And they aren't always big, huge, monstrous victories. Sometimes they're small, calculated victories, but those victories win the war. You don't win the war with one battle. You win them one victory at a time. So take good care of yourselves and show yourself a lot of self-compassion. If you haven't read Kristin Neff, she has a great website. I think it's selfcompassion.com or org. Use some of her tools and some of her meditations. They are marvelous. I think they're really, really great. As you deal with the pain and the exhaustion of trying to hold yourself together and hold the relationship together, and give yourself whatever space you need. So thank you guys for being here.
I just want to tag on to that. I had a spouse call me yesterday, and her husband had been a client this summer, but she sounded good, but we didn't want to answer the phone. But she said, I don't know what you guys did, but I got back a different man than the one I sent. And and she said, we talk, every night. They spend some time, and they like each other. I got goosebumps again, just, thinking about it, but that's what I see too. There's hope, and there is qualified help. Does every relationship make it? Does every addict get help? No. But there are enough victories, in that, and there's enough hope, that I hear along with the pain, that it makes me very motivated, to answer the phone, whatever time the phone is ringing. So thank you all for being here. I'll see you, Kim, in 2 weeks. And like I said, in January, we're going to start having these on a more regular basis. With the holidays, there'll be some meetings that won't happen, like, on Christmas Day and stuff. Although I think, I know New Year's Day we're going to have the betrayed partners. So just watch the calendar on on events, on sexandrelationshiphealing.com. I do try to keep that updated so that it's accurate. So thank you all for joining us. We wouldn't be here without you. So I so appreciate it.
Thank you, everyone. Thank you for being here. Come back and see us in 2 weeks.
Thank you, Kim. Bye-bye.